What's up guys, Dr. Greg here at Paramount Chiropractic, and today we're talking about a technique we use in the office for a lot of our joint conditions, but specifically for the knee. It's called Trigenics. It's a functional neurology technique which helps to restore the communication from the brain to the body, in this case specifically the knee joint. Whether it's been from previous trauma or injuries or chronic repetitive stressors, sports trauma to the knee, what can happen is called arthrogenic inhibition. So your brain just kind of forgets about these tissues as it's maybe been 4, 5, 6 months and just kind of moves on to the next problem. And what happens there is the biomechanical aspect and the neurological aspect fails, where you get this biomechanical dysfunction and it can lead to the breakdown of the knee joint. So we need to restore that on top of the other things that we can do in the office with decreasing inflammation, with our SoftWave technology, our knee on track with the laser. But we need to restore the communication from the brain and the body, because that's the supportive tissue of your knee joint. So you got your quad, your hamstrings, your gastroc, the popliteus. These are all tissues that help to stabilize the knee joint and allow it to move properly. So one of the simple moves I'm going to show here today, that's one of many of the techniques we'll use for the knee, is to help wake up the patellar tendon and the quad muscle to get them firing better. So what happens is the patient will breathe out as I tell them to, as they're actively pushing through a range of motion. So she's already been educated on what to do. The last thing is that I'm going to passively push through her tissue to kind of wake it up, so to speak. So what that looks like, so I'm gonna have you push down like so as you're breathing out. Let's have you go ahead and breathe.